Good morning, everyone. I am Josephine Shinuda, the Executive Director of the Early Intervention System, and it is my pleasure to welcome you to the 2026 New Jersey Early Intervention Conference. Thank you for joining us for this virtual gathering, and thank you for your time, energy, and commitment you bring every day to infants, toddlers, and families across New Jersey. Today is an opportunity for us to come together as one early intervention community. Our families, service coordinators, practitioners, administrators, family partners, state staff, community partners, and of course, our advocates. Although we're joining from different locations, we are united by a shared purpose, ensuring that infants and toddlers and their families receive timely, high-quality support that are grounded in everyday routines, relationships, and family priorities. This conference gives us space to learn, reflect, and strengthen our practice. It also gives us a chance to recognize the progress we've made as a system while remaining focused on the work ahead. Our continued priorities include quality services, family engagement, equity, accessibility, strong partnership, and improved child and family outcomes. This requires all of us together. They require collaboration across disciplines, across regions, and across systems. I want to express my sincere appreciation to everyone who helped plan today's conference, to our presenters and partners, to the families joining us today, and especially to the early intervention workforce and our DOH staff. Your dedication is the foundation of our system. Together, families and professionals support children during some of the most important and some of the most uncertain moments in early development. And you do so with partnership, professionalism, compassion, and skill. As we begin today, I encourage each of you to engage fully, ask questions, share your experience, and take away ideas that can strengthen our shared work with children and families. Thank you again for being here, and thank you for all that you do on behalf of New Jersey's youngest children and their families. And now it's my honor to introduce the Acting Commissioner of the New Jersey Department of Health, Dr. Raynard Washington. Dr. Raynard Washington leads the Department of Health, where more than 6,000 employees are dedicated to protecting the public's health and safety and making good health possible for all of us here in New Jersey. Dr. Washington brings a distinguished record of public health leadership. Before joining the department, he served as Public Health Director in North Carolina, where he advanced initiatives to expand access to healthcare, public health, mobile health, and dental care, and school-based physical and behavioral health services. We are grateful for his leadership and for his support of the New Jersey Early Intervention System. Please join me in welcoming Acting Commissioner Washington.
Thank you, Josephine. Much appreciated, and good morning, everyone. And welcome to the start of what I know will be an exciting and enriching day, all focused on early intervention. It is certainly a privilege for me to be able to join you all in this virtual space, and to welcome everyone on behalf of the Department of Health. Whether you're a frontline practitioner who works with families every day, or if you're a parent or a caregiver who knows this work from inside out, or a community partner who's helping us connect the dots. We're all united behind a shared belief that every child in New Jersey deserves to thrive from the very beginning. So let me just say thank you all for off the top for being here, and thank you for the work that you're doing, or the lived experience that you bring to this space today. I'm happy to represent Governor Sherrill, and very excited to share. As many of you may already know, just earlier this week or last week, the governor issued a proclamation declaring next week, May 18th through 23rd, as New Jersey's Early Intervention Week. And this proclamation is important. It's more than just a ceremonial gesture, but it's public recognition from the highest office in our state that the work happening in this virtual room matters. The governor's proclamation acknowledges that early identification and early intervention are proven, cost-effective measures that maximize developmental growth, help our kids get caught up, and it honors the professionals who are working every day to bring their expertise compassion and skill to the families across our state. It also affirms that our system is playing a vital role in building inclusive communities where every child has an opportunity to reach their full potential. The administration is committed to supporting children and families in New Jersey. That commitment is reflected in the governor's proposed budget, and it's anchored in making sure that all of our families have access to essential services like early intervention that's delivered both efficiently, accessible to everybody, and high quality. Early intervention is important, and it's important for all of our families. And my health department in Charlotte ran the early intervention program for the county. And I used to say it's one of those programs that every family can potentially one day need. And so it's so important to ensure that we have access across the entire state. In New Jersey, our system is serving or has served more than 37,000 families through personalized individual care plans. We've offered more than 2 million hours of therapy and evaluations, including critical speech and language access services. And the outcomes are clear. More than half of the kids in our that receive these services are showing improvement in cognition and communication skills, and two-thirds are making gains in their physical and adaptive abilities, which is absolutely incredible. And behind every one of these data points is a story. It's a toddler who said the first word after months of patient coaching, a parent who learned how to turn an everyday routine like bath time or breakfast into moments of connection and learning, and a family who walked into the office feeling uncertain, but with the support of their care coordination team, walked out feeling capable and able to move forward. These services are actually changing lives. They're changing the trajectory of childhoods and adulthoods, in fact. And so we are super excited and remain fully committed to supporting the more than 5,000 providers who make this work possible every day here in New Jersey. Our early intervention system is evolving to meet rising demand and to make it easier for more New Jerseyans to benefit from it. That's why we've made investments in things like telehealth. We've built stronger and deeper partnerships with community organizations and research partners to help us ensure that the therapy that we're offering is top notch and that the impact that we're intending to have we're making. And we've worked closely to continuously improve the referral process so that it's easier for families to get all the supports they need and to get connected to the program. And so while we at DOH are the state agency charged with overseeing early intervention services, we are really just one part of the system. So I just want to just quickly acknowledge and appreciate the regional early intervention collaboratives who have been providing that local level leadership for our system since 1993 across all four regions. You all are working to operate a single point of entry for referrals to support families through every stage of the journey and to train our providers who are delivering the work on the ground. You're truly the connective tissue of our system. I also want to extend my gratitude to the State Interagency Coordinating Council, whose members are advising our department on policy and advocacy efforts in order to ensure that our participants are well represented. It's your expertise and steady leadership that makes our system even stronger. I also must be honest that there's work ahead of us. Even with the strong enrollment that I mentioned earlier, there are still families I know out there in our state, in every county, who still need these supports and are not getting them. Some don't even know that we exist. Some are not sure if their child qualifies or needs it. And some are just simply too overwhelmed and don't know where to begin with all these processes. So we are focused on closing that gap and making sure that everyone is able to access these critical services that really can make a huge difference for an entire childhood, a family, and even into adulthood. And so I welcome all of you today and acknowledge that you are essential partners in helping us to be able to close those gaps and making sure that all the kids in our state who need these services are getting access to them. Parents and guardians, you guys are incredible, and just a huge shout out to you all. You are often our most powerful messengers in telling your experiences that you've lived, that you firsthand know how these programs are working and the value of them are makes you trusted messengers for us at the department and really a trusted guide for any new mom or dad or parent who's out there who might be in a similar situation. So each of you can be a voice that helps us and getting that message out to tell families don't hesitate, and to make sure that their kids are getting screened and if they need services, getting connected. So I hope today, in closing, that you guys find the schedule that they've planned to be exciting and engaging. I hope folks are able to gain some new perspective and new skills. But most importantly, I hope today you're able to connect with other people who are committed to this work in our state, and that those connections will flourish over the coming months and weeks and years into true partnerships that will help us in our work. The Department of Health is so proud to stand with our early intervention workforce. You guys are so critical, are a critical extension of us here at DOH. We're also super excited to have families here who are not just in the system, but serving the system and helping us as advocates and also connectors. And for every partner here that's working to ensure that no child in New Jersey is left behind in these critical years of life, I just say thank you. So welcome you all to the conference. Have a wonderful and productive day together. And thanks for having me here this morning.
So thank you, Josephine and Commissioner Washington, for getting us started today. So good morning, everyone. My name is Kristen Kugelman. I am the Professional Development Coordinator for the New Jersey Early Intervention System. We're really excited to have everyone here today, and we have a really full agenda, which you can see here on the screen, so I'm going to be very brief. If you're new to early intervention and want to know more about us, please check out the exhibitor tab in the lobby for some great resources. Professional development certificates will be available for all attendees at the end of the conference, and you're going to have the opportunity to download your own certificate. We are recording all parts of this conference, so you won't miss a thing. This platform will actually stay open for a year, so you can revisit it at any time, but there will also be recordings available on the New Jersey Early Intervention System Learning Management System for our workforce, and also the Family Matters website for all members of the public. Closed captioning is available for the keynote as well as all breakout sessions today, and the captioning can be translated into 49 different languages. New this year, we're offering CEUs to social workers and speech language professionals. In just a moment, you're going to hear more details about this process, so stay tuned. And finally, this conference would not have happened without many hands. So I want to give some thanks to our EI volunteers, Adam, Rob, and Yanela. And thank you to all of our guest presenters and the entire conference team of training and technical assistance coordinators and family support coordinators at the regional collaboratives. And a very special shout out to the conference co-chairs, Stephanie Flamini and Nicole Brogdon, who went above and beyond as usual. So without anything further from me, I'm going to turn it over to Stephanie Flamini, who is going to tell you everything you need to know about CEUs for this conference. Have a great day, everyone.
Hi, everybody. So as Kristen said, we are offering CEUs for today's conference for certain workshops. Our keynote, starting at 10 o'clock, will be available for 1.25 non-clinical CEUs for licensed social workers. So when we begin the keynote, after the keynote has ended, there will be an NASW specific survey link for social workers to complete. You will have 48 hours at the keynote's conclusion to fill out that survey. It does have a good amount of questions, but those are per NASW requirements. You will be able to access that survey, and I will give another announcement at the end of the keynote with where to find it. But when you're in the keynote, you will click the resources button and then select links, and that social work survey link will be there. This link will be available for the next 2 days. You can also email me if you need a copy of the survey link. Again, the keynote is only eligible for social work CEUs live only. We are not awarding CEUs for recorded workshops. Certificates for social workers will be issued between 2 to 4 weeks after the event to your email address. For speech language pathologists, there is an AM breakout session with an ASHA approved speaker, Rose Griffin. The workshop eligible for ASHA CEUs is Naturalistic Interventions for Autistic Learners, Getting Started. It is available for zero point 0.1 CEUs, or the equivalent of 1 hour. ASHA CEUs is only available for this workshop live only, and the presenter Rose will have an ASHA-specific CEU link for SLPs to complete. If you have any questions about CEUs, my email address is at the bottom. I will be sure to give another announcement during the keynote for social workers who might not be here for this announcement. And Rose Griffin for our AM breakout will also be providing directions for SLPs. We're very grateful for the opportunity to offer CEUs to our workforce. And we hope that all of the workshops today support your professional development. I'm going to now turn it over to my wonderful colleague, Nicole Ramirez, who is going to start us with a guided meditation to center our day.
Good morning, everyone. My name is Nicole Ramirez. I am the Training and Technical Assistance Coordinator for the Northeast Regional Early Intervention Collaborative. I am so excited to be part of this conference today. It's going to be a wonderful day. We wanted to take a little bit of time this morning to just ground ourselves with a little bit of mindful movement and some reflection to help get us focused. You know that for virtual conferences, especially, movement is so important and beneficial. It's a great way to start. And it's really nice to be able to take a little calm time to focus our minds to prepare for a great day of learning. So if you can, I want you to start by planting your feet right on the floor. If you can take your shoes off, that's even better. We're going to sit back kind of upright but comfortable. And just kind of, you can close your eyes if you want. You can soften your focus. We are going to start by just kind of moving a little bit top to bottom. I'm going to start by moving my right ear to my right shoulder, really getting a nice stretch in our neck. Try to keep your shoulders a little bit down. Don't push yourself past the point of what's comfortable, but just let yourself feel that stretch. And then we're going to keep breathing. We're going to move our chin to our chest. And you can feel that stretch in your back of your neck a little bit. It's helping to kind of get our muscles a little bit more energized. And then take your left ear to your left shoulder. I'm going to remind myself to keep my shoulders down because they always want to come up. And just feel your body getting that stretch out. It's going to help us feel nice and energized. Bring your chin back down to your chest. All right, and now let's come up. And again, I keep my tension in my shoulders. So I think some good big shoulder rubs. We're going to go around to the back, maybe 3 or 4 times, just big round circles. And now we're going to go the other way, around to the front. I can hear a little bit of my muscles and bones going. And now we really want to engage our core. So if you have a share with armrest, you can grab onto your armrest. We're going to cross our body. My right arm is going to my left side. If you don't have an armrest, you can just kind of put it on your hip, whatever's comfortable. You can reach the back of your chair if that isn't uncomfortable. And just look over your left shoulder. You're going to feel that stretch in your back and your spine a little bit. This is my favorite stretch in the world. Spend a little bit of time here breathing. And then we're going to release and we're going to go the other way. So left arm to your right side, twist around. And just feel that stretch. All right. And last, we're going to just kind of do our legs a little bit. You can't see my legs, but just if you bring them out in front of you and just try to reach down, reach out over them with your back a little bit flat, you're going to feel that stretch in like the backs of your legs. We kind of forget about our legs, I think, sometimes when we're sitting down, if we're driving a lot during the day. It's a lot of nice stretching we can do. And one more, we're going to put our legs back down a little bit, and this time we're going to roll our back, kind of touching our toes. And that gives you a little bit of a stretch through your hips. All right. And now just come back, sit. We're just going to take a little bit of time to breathe. Just do a quick body scan. This helps get a sense of where we are for the day. Breathing in, breathe out. Be a little loud if you can, especially if you're alone. Nobody can hear you. In and out. And just notice your body. Notice anywhere that might be more energized now, anywhere that has some tension still, maybe anywhere you're just not feeling connected to right now. And as you're breathing in, think about the energy coming in. As you're breathing out, breathe out the tension. And I want to come back now as we are kind of getting our body and our systems all set. I want to bring attention to this quote that's on the screen. The greatest good you can do for another is not just to share your riches, but reveal to him his own. So I really want you to think about this. We're going to hold on to it throughout the day. What does it bring to your mind? Are there any specific people or specific relationships or specific experiences you've had where this quote makes you, triggers that for you, triggers something for you? If you can, just hold on to any feelings or wonderings that this quote brings up, and keep them with you throughout the day. And I'm going to let Stephanie finish our reflection for this morning.
Thanks, Nicole. That was so wonderful. Okay, everybody. Now that we're a lot more centered, it's so important to take time to center ourselves, especially, I think, in this line of work that we have. I wanted to talk a little bit about some reflective things to think through as we move through our day. So I put together something that I want us all to do some critical thinking about and reflect on. In early intervention, I believe that our model reflects the quote, "No journey is achieved alone." Our work depends on connection and collaboration. Each of us holds a different piece of the puzzle, and together we support a child and family's growth. We also support the growth of our early intervention system. Consider what becomes possible when people feel included in the process. And when they do, they're far more likely to commit to the outcomes. And that's a lot of what our focus is on today, specific to connection and caregiver collaboration. As we move into our exploration of caregiver coaching, collaboration, and connection, take a moment to reflect. What does it feel like when my voice is truly heard? How does it feel when I'm included in shaping the process and not just informed of the decision? Trust and reflection can transform stressful, confusing situations into productive, more hopeful ones. My hope is that this conference urges you to think critically about how we recognize different experiences, all of the valuable different roles that we play in our system, how we can practice perspective taking, listen to understand, and how our early intervention model can become something that we practice rather than something that we talk about. I hope you leave today feeling a bit more confident, supported, and equipped in your work with children, families, and one another. As you return to your daily practice, I invite you to practice small shifts, a new question that you ask, an intentional pause that you offer someone, a perspective that you invite, a specific piece of encouragement that you give. All of us play a key role in supporting children and families, and all of us play a key role in building the capacity for a strong early intervention system. Thank you all so much for joining this morning reflection. Thank you all so much for joining us today. I'm very confident that you'll leave today with a lot of strategies and resources and just a sense of togetherness, because that's really the heart of what I think early intervention is. So as we look at this quote, think about all of the riches that you have as a professional, as a parent, as a stakeholder, as a community member, and how that contributes to the journey of early intervention. I'd like you all now to take a moment, and what we're going to do is leave this morning reflection. So you're going to hit leave webinar. It's going to take you back to the lobby, and you're going to find the keynote, which you can enter at 10 o'clock, or it's a little bit before 10 o'clock. So you can still enter it, but we're going to leave this room, enter the lobby, and then enter the keynote. Thank you all so much for being here today.